Good morning, guys. Today I will start the our subject general surgery, first section, that section for surgery, and go on with topics, name of topics. What you will have in this here, and you see that first topic is introduction. The last topic is the general provisions of reconstructive surgery and the body's reaction to it. The concept of surgery and surgical disease. Contemporary surgical therapy is greatly helped by monitoring devices that are used during surgery and during the postoperative period. Blood pressure and pulse rate are monitored during an operation because a fall in the former and a rise in the latter give evidence of a critical loss of blood. Other items monitored are the heart contractions as indicated by electrocardiograms. Tracings of brain waves recorded by electroencephalograms, which reflect changes in brain function, the oxygen level in arteries and veins, carbon dioxide partial pressure in the circulating blood, and respiratory volume and exchange. Intensive monitoring of the patient usually continues into the critical postoperative state. Asepsis. The freedom from contamination by pathogenic organisms requires that all instruments and dry goods coming in contact with the surgical field be sterilized. This is accomplished by placing the materials in an autoclave which subjects its contents to a period of steam under pressure. Chemical sterilization of some instruments is also used. The patient's skin is sterilized by chemicals and members of the surgical team scrub their hands and forearms with antiseptic or disinfectant salts. Sterilized cones, caps, and masks that filter the team's exhaled air and sterilized cloth of disposable plates complete the picture. Thereafter, attention to avoiding contact with non-sterile objects is the basis of maintaining asepsis. The next term what's important for us is a hemostasis. During an operation, hemostasis, the resting of bleeding, is achieved by use of the hemostat, a clamp with ratchets that grasps blood vessels or tissue. After application of hemostasis, suture materials are tied around the bleeding vessels. Absorbent sterile napkins called sponges made of a variety of natural and synthetic materials are used for drying the field. Bleeding may also be controlled by electrocautery, the use of an instrument head with an electric current to cauteries or burn vessel tissue. The most commonly used instruments in surgery are still the scalpel or knife, hemostatic forceps, flexible tissue holding forceps, wound retractors for exposure, crushing and non-crushing clamps for intestinal and vascular surgery, and the curved needle for working in depth. Wounds. The most common method of closing wounds is by sutures. There are two basic types of suture materials: absorbable ones such as catgut, which comes from sheep intestine, or synthetic substitutes, and non-absorbable materials such as nylon sutures, silk staples, or adhesive tissue tape. Catgut is still used extensively to tie off small blood vessels that are bleeding, and since the body absorbs it over time, no foreign materials are left in the wound to become a focus for disease organisms. Nylon stitches and steel staples are removed when sufficient healing has taken place. Wound treatment. There are three general techniques of wound treatment. Primary intention, in which all tissue, including the skin, are closed with suture material after completion of the operation. Secondary intention, in which the wound is left open and closes naturally with the organism power. And third intention, in which the wound is left open for a number of days and then closed if it is found to be clean. Wound treatment. The third technique is used in badly contaminated wounds to allow drainage and thus avoid the entrapment of microorganisms. Medical surgeons use this technique on wounds contaminated by shell fragments, pieces of clothing, and dirt. The 20th and 21st centuries witnessed several new surgical technologies to supplement the techniques of manual incision. Lasers become widely used to destroy tumors and other pigment lesions, some of which are inaccessible by conventional surgery. They are also used to surgically weld stitched retinas back in place and to coagulate blood vessels, stop them from bleeding. Stereotactic surgery uses a three-dimensional system of coordinates obtained by X-ray photography to accurately focus high-intensity radiation called HET or chemicals on tumors located deep in the brain that could not otherwise be reached. Cryosurgery uses X-ray cold to destroy warts and precancerous and cancerous skin lesions and to remove cataracts. Some traditional techniques of open surgery were replaced by the use of thin, flexible fiber optic tube equipped with a live and a video connection. The tube or endoscope is inserted into various bodily passages and provides use of the interior of hollow organs or vessels. Accessories added to the endoscope allow smooth surgical procedures to be executed inside the body without making a major incision. Preoperative and postoperative care both have the same object: to restore patients to as near their normal physiologic state as possible. Blood transfusions, intravenous administration of fluids, and the use of measures to prevent common complications such as lung infection and blood clotting in the legs are the principal features of postoperative care. There are four major categories of surgery: wound treatment, extirpative surgery, reconstructive surgery, and transplantation surgery. Wound surgery. The technical aspects of wound surgery, already partly discussed, center on procuring good healing and the avoidance of infections. Extirpative surgery involves the removal of diseased tissue or organs. Cancer surgery usually falls into the category with mastectomy, removal of the breast, cholecystectomy, removal of the gallbladder, and hysterectomy, removal of the uterus, among the most frequent procedures. Reconstructive surgery deals with the replacement of uh, lost tissues, whether from fractures, burns, or degenerative disease process, in especially prominent in the practice of plastic surgery and orthopedic surgery. Yeah, when we're talking about reconstructive surgery, plastic surgery, we talk about grafts from the patients or from other are frequently used to replace lost tissues. Reconstructive surgery also use artificially surgery uh, also use artificial device prosthesis to replace damaged or diseased organs or tissue. Common examples are the use of metal in reconstruction hip joints and the use of plastic valves to replace heart valves. Transplantation surgery involves the use of organs transplanted from other bodies to replace deceased organs in patients. Kidneys are the most commonly transplanted organs. Major medical specialties. The major medical specialties involving surgery are general surgery, plastic surgery, orthopedic surgery, obstetrics and gynecology, neurosurgery, thoracic surgery, colon and rectal surgery, otolaryngology, ophthalmology, and urology. General surgery is the parent specialty and now centers on operations involving the stomach, intestines, breast, blood vessels in the extremities, endocrine gland tumors of soft tissue, and amputations. Plastic surgery is concerned with the bodily surface and with reconstructive work of the face and exposed parts. Orthopedic surgery deals with the bones, tendons, ligaments, and muscles. Fractures of the extremities and congenital skeletal defects are common targets of treatment. Obstetricians perform caesarean sections, while gynecologists operate to remove tumors from the uterus and ovaries. Neurosurgeons operate to remove brain tumors, treat injuries to the brain resulting from skull fractures, and treat ruptured intervertebral discs that affect the spinal cord. Thoracic surgeons treat disorders of the lungs. The subspecialty of cardiovascular surgery is concerned with the heart and its major blood vessels and has become a major field of surgical endeavor. Colon and rectal surgery deals with disorders of the large intestine. Otolaryngology surgery is performed in the area of the ear, nose, and throat, while ophthalmologic surgery deals with disorders of the eyes. Urologic surgery treats disease of the urinary tract and in males of the genital apparatus. The subject and task of general surgery. General surgery is a discipline of surgery having a central core of knowledge embracing anatomy, physiology, metabolism, immunology, nutrition, pathology, wound healing, shock and resuscitation, intensive care, and neoplasia, which are common to all surgical specialties. General surgery has specialist knowledge and experience related to the diagnosis, preoperative, operative, and postoperative management, including the management of complications in 9 primary components of surgery, all of which are essential to the education of a broadly based surgeon. It is alimentary tract, abdomen and its contents, breast, skin and soft tissue, head and neck, including trauma, vascular, endocrine, congenital and oncologic disorders, particularly tumors of the skin, salivary glands, thyroid, parathyroid, and the oral cavity. Vascular system, excluding the intracranial vessels and heart, endocrine system, including thyroid, parathyroid, adrenal, and endocrine pancreas. Surgical oncology, including coordinated multimodality management of the cancer patient by screening, surveillance, surgical adjunctive therapy, rehabilitation, and follow-up. Comprehensive management of trauma included musculoskeletal, hand, and head injuries. The responsibility for all phases of care of the injured patient is an essential component of general surgery. Complete care of critically ill patients with underlying surgical condition in the emergency room, intensive care unit, and trauma burns units. The procedure for providing medical care to the adult population in the surgery profile. And there you see three terms: polyclinic, hospital, ambulance. All help or care of surgery will start from polyclinic. Yeah? Every patient need coming to polyclinic. For example, if patient has suppurative disease, they go to polyclinic and the surgeon in polyclinic do the small cutting, do drainage, and do the bandage of the wound with uh, medical treatment, yeah, conservative treatment, for example, antibiotic therapy and therapy of nuns, non-steroid drugs. It's type when we go to polyclinic. Hospital. In what moment we need to go to hospital? It is the pain uh, inside the abdomen. All pain in abdomen, you need to go to hospital, and you can do it in ambulance. What else? For example, it is a acute trauma of the abdomen or thoracic trauma, or it is a gangrene, a blood arrest of the extremity, for example. And I think that's all when the patient can take the ambulance and go to the hospital. After the hospital, after the ticket, all patients go to polyclinic, and this is a medical care of the surgery profile. Surgical ethics and deontology. The practice of surgery is based on the technical capabilities of surgeons, their knowledge, and their capacity of judgment. Surgeons face situations that call into question moral choices and face ethical difficulties in their daily practice. In fact, innovation is increasing, and as operations become more complex and the risks become greater, the tools necessary to approach an ethically challenging surgical case become more important. Surgical ethics can be distinguished from other medical ethics fields because of its unique characteristics and goals. Ethics lie at the core of professionalism. A proficient surgeon is considered to be not only competent to perform the art and science of surgery as traditionally understood, but also to be ethically and morally reliable. The principlism and the four-box model approach to clinic ethics could serve as a guide to the surgical ethics discussion. There are five categories of experience and relationships that are especially important in surgery: risk, proximity, ordeal, aftermath, and presence. Ethical reasoning should help surgeons to give answers to the questions: what should be done? Has the right decision in the situation been made? And from myself, I can give you one more question. Uh, did I do like I do for myself? Did I do for patient like I want to do myself? Thanks for watching, guys. Have a nice day and see you in the class or in the exam. Bye bye.